The Nigerian Center for Disease Control has confirmed over 2,600 cases of Lassa fever and 84 deaths in Nigeria. This is our focus today on sound health. Good evening. I am Olasunbo Murupe. Thanks for always staying tuned. The conversation begins after this break.
In 1974, WHO launched the expanded program on immunization to ensure all children in all countries benefit from the life-saving power of vaccines. Initially, for 6 major diseases: diphtheria, pertussis, tetanus, polio, measles, and tuberculosis. At the time, only about 10% of the world's children received 3 doses of DTP vaccine. Thanks to the expanded program on immunization, or EPI, it reached 86% in 2019, but has slipped since then owing to the disruptions of the COVID-19 pandemic and the very big campaign of anti-vaxxers. Today, more than 30 diseases are vaccine preventable. Vaccines are among the most powerful innovations in human history. Vaccines now give us hope of eliminating cervical cancer. Vaccines are helping us to snuff out Ebola outbreaks faster. For the first time, we can say that malaria is a vaccine-preventable disease. Vaccines were critical in ending COVID-19 as a global health emergency, and vaccines have brought us to the threshold of eradicating polio. Through WHO's support of countries to ensure access to vaccines for all children, we're helping to avert more than 4 million doses every year.
It is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Oladipo Kolawole, an infectious disease expert with the Adeleke University and founder Elix Baojin Institute. He is an international fellow of Indian Council of Medical Research, African Union SARC Honorary Associate Professor, Departments of Chemical Engineering, Birmingham University, UK. Good evening, Dr. Kolawole, and thanks for joining us.
Yeah, thank you for having me on the show this evening.
All right, the Nigerian Center for Disease Control and Prevention recently reported that over 80 deaths have been reported in about 23 states in Nigeria. Tell us more about this discovery by the NCDC.
Well, I cannot say that it's a discovery because Lassa fever is actually endemic in West African countries, which is we have Cameroon, Guinea, and Nigeria is one of them. And if you look at the story behind it, the virus was isolated in 1969 from Nigeria, from Lassa village in the northern part of the country. So definitely, it means that the virus is endemic. And if we look at the distribution, the season, it has a season that we actually have to record the incidence of Lassa in Nigeria. So when we say something is discovery, it's something that have not been in existence and we are just finding it out. So we have known that Lassa is with us in this country, and we have mapped out the season that it always come out. So the question is, what are we doing about it? I have known that for this season, this thing will come up. So those are the things we should be talking about. So it's endemic in Nigeria, it's endemic in West Africa, some of the countries in West Africa, and Nigeria, it's one of them.
Okay, if this condition is, if this development is seasonal, how did we wait till we reported about 2,600 cases, confirmed cases, in 23 states?
Well, you know that we have a challenge about the clinical diagnostics of Lassa, uh, and we don't have all labs that can diagnose them laboratorically. We have clinical diagnostics and laboratory diagnostics. So when I said that last time I mentioned of clinical diagnostics, it means you are using clinical manifestations to map out or rule out that this is likely the disease that a patient is suffering from. Because we have headache, malaise, that is myalgia, that's muscle pain, joint pain, some of the time associated with it. So we'll have other ailments too, diseases that shared with the same clinical sign that Lassa is sharing. So if not the season, if a patient is coming to the clinic, you would not want to think in that line, in the first line of treatment. And don't forget again that the economic situation of the country is a contributing factor to what is happening now, because the medical bill is super expensive. So when people are experiencing that kind of symptoms and signs, they may not go to appropriate health facility to be diagnosed. So they might be doing self-medication. So by the time they will be get into the hospital, the disease would have advanced. Some of the time it could lead to hemorrhagic fever too, that we have blood coming out from the eyes, from the nose, from the mouth, from the ear, from the orifice of the body. So at that stage, you know that it needs proper treatment, and surviving is very, very rare. The reason why they said 2000 is because, assuming like the theory I propounded now, somebody taking self-medication would have had contact with people in the house, and within 1 to 3 weeks, that is the gestation period of the Lassa fever virus to manifest infection, to manifest clinical signs rather, and symptoms. So you know that somebody at the advanced stage would have had contact with one or too many people, which will increase the number of cases. And that is one thing that we should look into, that the economic situation is a contributing factor to the high number that we are also reporting in this season, because people don't have enough cash to go to the clinic for them to be examined. And like I said, it is not something that is diagnosed naturally in the hospital. So we have reference labs. One is in Bini, then they take it to Abuja. So even if it is something that is domesticated in our hospitals, the diagnostics will be quicker than what we are experiencing now.
Okay, so before we talk more about symptoms and how to prevent further spread of Lassa fever, let us know what Lassa fever is.
Well, like we rightly said all the time, is an animal-borne disease, and it's zoonotic, and it's transmitted by African rats. And what it does is that this rat, it stay within us. So once our foodstuff is not properly kept, and those rats generate or excrete on it, and we consume it. So from there we can pick up the virus, and the virus now can cause damages to our body system. So the major thing, like we already said, is we have to get rid of rats in our community, in our house, in our environment. It will be difficult for us now to be screening rats in our houses to know the specific one that really cause Lassa, but just get rid of
Rats.
all rats. It's not only Lassa, that rats also serve as a vector for. So there are some other diseases again that rats also serve as a vector for. And our personal hygiene is also very, very important in the house, where our foodstuff are being kept in a sealed container that it's covered. Even if you have rice in your bag, other things, that if rice in your house, they can go there and eat it up because they want to feed, they want to survive too. So once we can get rid of rats in our environment, in our community, the transmission rate will actually reduce.
Okay, earlier you said the gestation period is about 2 weeks. Does the symptoms manifest before 2 weeks? And tell us, what are these symptoms apart from the hemorrhagic fever, body pain?
Well, with what I have, with what I have seen, with what I've worked on, naturally the period is 1 to 3 weeks, and that is dependent on the immune status of the patient and the viral load at that time. So that is why we have a varied week, which is 1 to 3 weeks before we can get that. And it's just slight fever. You can have slight fever. And what we call fever is abnormal body temperature, either hypo or hyper. So any one of them, that is just fever naturally. And most of the time we have general malaise and weakness, headache, and that's why I said the other time that clinical manifestation, it's difficult to really diagnose because of some other ailments that share the same. So the major way of diagnosing Lassa is just the laboratory diagnosis, so that you can confirm everybody that have that kind of illness need to further testing, so that you can really say that Lassa is what we have. And it's also associated with occupational epidemic, because if a Lassa patient comes into the clinic and they need to be admitted, don't forget that health personnel will be having contact with such an individual before the real diagnosis come. But some of the time, such individuals can be taken to an isolation ward or center, where so that other patients in the hospital will not be at risk, so that it will turn to hospital-acquired infection or nosocomial infection. So that is what I can say in this regard now.
Okay, it is sad that some health practitioners, medical officers, passed away as a result of the Lassa fever outbreak in those states we mentioned. Tell us now, what are the precautionary measures that we must adhere to, starting with our healthcare practitioners before we move to the home front?
Well, like I said, one of the things that we need to do is that now that we have understood the season, which is something that occurs every year.
Okay. Dr. Kolawole, let me chip this in. Let me ask this question. Does that mean Lassa fever will always be with us? Will it ever end?
Yeah, Lassa fever will be with us until there is a vaccine for it. Because that's why we say it is endemic. So if there's something we say that prevention is better than cure. So it is better to prevent it happening than allow it to happen. Then we are now putting curative measure in place. So because you can't kill all the rats, we can't go to the bush and start killing, and you can't limit human activities, and that's why I call zoonotics, because people still go for game hunting. So people will still go into the bush, those rats will still reproduce and get more of it. So we cannot stop that thing. So unless we have a vaccine, and again is that once we have understood the season, we should not stop educating our people. Once we know that we are approaching the season, that we do record Lassa. So before that time, we should be more proactive in sensitizing the population about the potential risk of contracting that virus, so that it will not lead to what we are recording now. And I think the health workers should also be educated. There's something there's another course that is called infection prevention control. That's the course that all health workers should be used to, and treat every patient as a potential patient. And let me tell you the truth again, you cannot hear that an health worker died in an area where the virus is not endemic. So once I am working in an endemic environment as an healthcare worker, I should have that at the back of my mind to put on all the necessary PPE, that is personal protective equipment, that I need to put on once I have a suspect, and because from experience, if you are working in an endemic area, you should have an experience how the patient presents themselves in the hospital. So once you have that, the PPE should not be far away from such an individual.
84 local governments are experiencing the Lassa fever outbreak now. What should be done to, obviously these local governments have experienced close contacts with infected persons. What should be done to trace contact to minimize further threats?
I think what we need to do now is one of the things what we are doing. We need to come out to the populace and tell them what they are at risk of, and we can release a lot of infographics materials both in local and indigenous languages, so that we can use that to communicate about the transmission, the clinical signs and symptoms, then the preventive measures that we can put in place, and allow people to tell them that if you are experiencing this kind of signs and symptoms, please kindly go to these health facilities, and the government should make provision for free testing, that once you get there, you can be tested freely and we can know, and there should be proper documentation for patient to be sincere, because if a patient is confirmed positive and they are asking that where are the places you have gone to, there should be a level of sincerity to mention that, oh, I have been at this place, so that those who are doing the contact tracing will be able to do it effectively. Because if truth is not being told, it will be difficult and the contact tracing will not be effective.
All right, the vaccine is not yet in Nigeria. What are the treatment options for Lassa fever?
I think for now there are a lot of drugs that you use. Some of the time it's treated symptomatically, based on the symptoms that the patient is giving, and there are some other therapy that's under clinical trial. I know that there are some Lassa fever vaccine candidates that's on trial for now, that need to see if it's going to be effective. So most of the time we advise those individuals to go to the nearest hospital where the medical doctors there will be able to treat accordingly, because the treatment for A might be different from the treatment for B based on the clinical manifestations and the stage at which the patient is actually is. Some of the time on TV show like this, it's very difficult to mention a particular treatment, because somebody can sit there in the house and feel that, oh, this is what they said they used to just go there to buy. So we leave that to when you get to the clinic, the appropriate treatment that is meant for that disease condition will be administered appropriately.
All right, we still have some lovers of bush rats out there, lovers of bush meat. What advice do you have for them as you give us your final thoughts?
Well, I think it should be well cooked. If it's well cooked, I think this should be safe. But if it's something they can avoid for this season, the best advice is for them to avoid it. And those who are going into the bush should be careful. I know some will say they are going there for their daily living, that's where they get their daily living from. But because some of these animals that they kill in the bush, their X status is not known. And like I said, beyond Lassa, there are some of the other pathogens that those animals are harboring. And that's why if you go to our abattoir, we have vet doctor there that are trying to inspect the animal, saying that the animal are in good health before it's being consumed. So another simple strategy is taking good care of our food stocks. Put them in a place where animals cannot reach, so that it will be safe from rodents. They will not generate, they will not defecate on it physically or pass on it. So I think that's the kind of advice I have for people at home.
Dr. Oladipo Kolawole, infectious disease expert with Adeleke University and founder Helix Biogen Institute, thank you so much for your thoughts on how to reduce the Lassa fever outbreak in Nigeria.
Thank you for having me. I'm super grateful, man.
Right, Sound Health continues with trending health report from around the world. Please stay tuned. It is still Sound Health on Lagos Television. More to come in a moment. Well, the program has been Sound Health on Lagos Television, and today we've been talking about Lassa fever, the Lassa fever outbreak. Over 84 local governments have reported the cases of Lassa fever. That's in about 23 states. Please protect yourself and your loved ones. Preserve your foods, cover your foods properly, and report symptoms early enough to the nearest health facilities. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 0035826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.